Okay, I think it's a good time to start. First of all, hi everyone. My name is Tom Carter. I'm the Junior Coordinator for the European Forum for Primary Care, alongside my colleague Diederik Arendonk, who is the coordinator of the EFPC. Just a quick note. Hopefully, everyone is doing okay at the moment. Obviously, given the circumstances, and friendly friends and family and loved ones. Hopefully, we're all doing fine as well. I just want to give a quick introduction of how we're going to do things today, just before I hand over to our moderator. Obviously, we only have 60 minutes, so of course, we're going to try and get as much discussion in as possible. So first of all, just to go through some of the basic rules, if we keep all of our webcams off and microphones muted, observers, if you've been given an email to say that you are an observer, feel free to add any questions or comments into the chat function, and all of this will be saved. We have a record of all of the discussion anyway. And for participants, if you want to please switch on your microphone or webcam when you want to speak, and try to keep this limited in your talking time and also one at a time, so we avoid lots of people talking over one another. Just here, you obviously can see the main questions of today as well. So just have a quick think about what things we'd like to discuss. Now, just briefly, when you first came in, I did have this poster up, which is our next week's webinar on Thursday, the 16th of April. Again, we're doing 2 time slots, and we have basically a webinar with video experiences from primary care practices across Europe dealing with the coronavirus crisis at the moment. What I'm going to do briefly is hand over to my colleague Diederik, who has a short video clip of this, if we can get that working. Diederik, is it working for you? Yeah. Perfect. There's a slight issue with the sound there, Diederik. I don't think we can hear.
Sorry.
No problem.
Sorry, I will start. It's just 40 seconds, so I will start again. Here it is.
As you see here, that there are no patients now. Normally, we have these 10 patients waiting for doctor here. But since our government has announced to stay home most of the time, the patients much more like waiting there, waiting at home, and very rarely visiting our primary care unit. Let's move.
Okay, that was the short introduction, introducing the topic of today. This was in Istanbul. Our colleague there explaining what's happening. I want to hand over to Martin to share this focus group. Martin, go ahead, and Tom, take over the screen, please.
Okay, so good evening, everybody. So this is our second focus group today. So I will make a short, brief summary of the focus group we had before lunch. But before I do that, I'll make just an introduction. So our societies are in a COVID-19 modus, and our healthcare system are in a COVID-19 modus somehow. So things have changed for people who have acute illnesses or diseases and chronic diseases, but things have always also changed for people who are living in long-term institutions, people who are mentally ill, children, also the elderly. So things have changed a lot, and so this focus group is a lot about this. What is the collateral damage we can observe in different countries for different groups, and what could cause this collateral damage, and who are the vulnerable groups, and maybe let's talk about some strategies as well. So I just give a brief summary of the focus group before lunch. So what we identified there is that actually it's we have negative impacts across all age groups. So we have impact on babies as well, on very frail and old people, but we have impact on also in different settings. So the hospital, the way our hospitals are working has changed, the way primary care is working has changed, but also the way long-term institutions are working has changed, but maybe also the way NGOs are working has changed. And even where the people live at home and care for themselves, even these things have changed. So we have a growing distance because of a lot more telemedicine and teleconsulting. So, and this was the issues we were talking about. So especially we talked about mental care. We covered a lot, and we covered a lot. But homeless people, drug addicts were also a group we talked about. And but again, this focus group is open, and we are looking forward to listen to your observations. So I would just invite you. So who wants just to talk and tell us what he or she observes in her or his country at these times?
That Lorena takes the floor, because this afternoon she wasn't able. So Lorena, can you introduce some briefly things from Germany?
Yes, thank you, Dederick. Hi, everyone. Indeed, I had to leave this afternoon, and at that moment I was about to say some things, and I don't know if now I remember everything, but anyway, here it is. Where one of the main things that I am observing as a collateral damage is not only related in Germany. I'm based in Berlin at the Charité, right? And I'm working from home and not taking care of patients, but I'm in contact with a lot of GPs, offices, and speaking with them regularly. We're also having a telephone hotline for patients. There are a lot of new initiatives being implemented. There is a lot of goodwill for everyone. But I am observing that there is a misinformation, that the information distributed is not precise and not structured enough for doctors and for patients. At the same time, there is an overload of information, but the information is like not structured. For example, when and how do you use the mask? When and how do you wash your hands? When and how do you need the distancing? For example, people are worrying with those questions, and it is due to how communication is structured. For example, if you say you have to wash your hands regularly, do you wash your hands if you are at home all the time? And people do not logically follow this structure. At the same time, for example, there are internal communications for the doctors that we can now, based on a telephone consultation, send the patient to other specialists. But the patients don't know it, so they try and want to come. Some call, some come to the office. So then we have also a discrepancy. There is also observed reduced willingness, not willingness, but awareness of the patients to consult, even though they have chronic conditions, because of the fear of getting contaminated. At the testing stations, the people are also not coming because of the fear of getting the virus while getting tested for the virus. And there is, at the beginning, there was a lot of lack of training of doctors, for example, not even used to use hand gloves for performing the test. So we have some images in the television of some doctors performing the tests without the gloves. And so there is a lot of insecurity and a lot of anxiety in the health workers and in the population. And the uptake of the information is because of this information is not properly structured, and at the same time this overwhelming information. So I think that is one of the things that maybe the European Forum could also advocate for, in how to present the information so that it is properly structured, so that the people can understand it, and that it is streamlined and coherent, right? And we have now, for example, you can stay even in the park for some time if you are at 5 meters distance. But the question is, do you also need to have a mouth protection or face protection if you are 5 meters? So there is this lot of precisions about how to implement the new rules, and the economic impacts are starting to worry people, and the testing of antibodies is coming now. So the role of the GPs and the primary healthcare teams in conducting this testing of antibodies is also uncertain. A lot of questions about how the remuneration is going to be structured and who is going to pay for the health services has been cleared. And well, it's a challenging time that we are trying to do our best to focus on this. So this is mainly for the first what I have.
Yeah, Lorena, just very briefly. So you said people with chronic diseases are waiting quite long before they come or use healthcare because they are afraid of being contaminated. Do you think it's just an issue of the first 2 weeks now, or do you think this issue could increase in the next 2 or 3 weeks or 4 weeks or even months to come?
Well, you know, here in Germany, everybody or GPs or ambulatory practitioners think in quarters. So one quarter has just ended, so we have to see about the numbers and how that evolves. We have been thinking about if GPs need to go outside and do home visits to collect the chip to be able to get the money or not. Very simple things like that have been in the mind. Finally, we have decided not to, but I'm not sure. I think you are asking from our own perception. I think at the beginning it was very strict and all the rules were tried to be followed. And now people are getting like tired and trying and sensing like there is like not full coherence in the guidelines. So I believe that now maybe people get a little bit smoother with the implementation of the guidelines, including maybe the consultation. But that video that Dederick was showing here, it is the same. In the emergency room at the Charité, it's like nobody is coming. So you wonder why are they not coming? And I have heard reports from some GPs that even patients call. And for example, one patient was calling and saying she had like abdominal pain, and the doctor was asking, well, do you need me to come now or can it wait? No, it can wait. And it was an aneurysma, exploded, and the patient then finally died in the hospital. So it's difficult. We have to observe. I'm not sure how it will evolve.
Thank you, Lorena. This is wonderful. But I saw a microphone coming up from Marise Arendt from Luxembourg from a dietitian perspective. So may I give you the floor? Before doing that, may I recommend the chat box? If you want to give some comments, please use the chat box for any recommendation, problem, or suggestion. Please, Marise, go ahead.
Yes, hello, this is Marise Arendt from Luxembourg.
Now you closed your microphone. Keep it open. Yeah, that's it.
Okay. And I'm a member of the International Baby Food Action Network. And so we are hearing a lot of the collateral damage that actually parents which are giving birth, women and their partners, are living through because of the some hospitals are separating the mother from their partner during birth. That's very widespread in Eastern Europe, less in Western Europe. And also there was a good practice of having the baby in skin to skin immediately after birth. And some hospitals for precaution are not even allowing women who are not positive or have no COVID to have the baby with them. And this also disturbs the breastfeeding, the early initiation of breastfeeding and the continuation of the breastfeeding if the baby is not in the same room as the mother during maternity stay. And in a lot of countries, mothers are discharged very early. And due to shortage of health professionals, they will not have at home all the support they need to look after the baby if it's a firstborn baby and they have no experience at all.
Yeah. Okay. Do you observe any issues of inequality? So groups are more affected than other groups?
Yes, I think that the parents who are more vocal can ask maybe for more, but if the protocol of the hospital is very strict, they will not be allowed. The father, for example, will not be allowed to come with the mother. And of course, later on during breastfeeding, there are just women who don't dare to ask for help or support.
Yeah.
And that's a pity, because then if the breastfeeding goes wrong or is stopped,
yeah,
this will prevent the health effects, the positive health effect that breastfeeding has on the health of the mother and the baby.
Yeah,
which is very important, because there is a lot of immune transfer from the mother to the baby, and leaving the baby more vulnerable when he's not breastfed.
Can you observe anything else? For example, cesarean section going up, or decisions are made differently?
In some hospitals, I have heard that this is happening. Yes.
Yeah, because I've heard this from Austria as well. Yeah.
Yes.
Alexander Tsipou from Greece. Do you have anything from the Greek situation? Can you say a few words on this?
No, I have not heard back from our Greece part of the organization, so I can't say something about Greece. And I think it's important. WHO has very good recommendation on birth and breastfeeding, as have UNICEF, and they need to be more shared with hospitals and the deciders, so that they can be observed.
Can you tell us Europe's observations about collateral damage, maybe in other groups, other settings?
But I think we have a Greek dietitian, Vivian Detopoulou, who can say some words about the Greek situation in that respect.
Yes. Hello. I am a member of the Hellenic Dietetic Association. I'm a dietitian, and I work in a hospital. Well, Greek people in general stay at home. They listen every day to Professor Theodras regarding the news on coronavirus. As far as hospitals are concerned, in general, they are not full. Older people are afraid to go to the hospital. They have special hospitals for coronavirus patients. They are more full, but the other hospitals have few patients. Only urgent surgeries are done. Now people in general worry about economy, about their works. They're afraid that after the crisis, maybe they won't have any work. Some of them do telemeetings and work from home. Also, dietitians have done that. They work from home.
Can you focus on the collateral damage in that respect? Are there any mental health problems because of this problems with future perspectives?
Mental health problems, I have not observed. I don't know if they are. Maybe.
Do you have any additional views on this from the primary care level? Are you able to join with your microphone?
Yes, yes. For the primary care, no, I don't have any data on that.
No.
Another observation I have, in general, of course, is that dietary habits have changed. I think that more, how to say, that maybe fresh foods are not so much eaten. People do massive buys, and I think that when fresh fruit is over, let's say, and vegetables, maybe they don't buy so often. They try not to go to the supermarket very often. So if their stock is over, maybe they don't eat so much fruit and vegetables.
Okay.
That's
So
from my observations.
Yeah. Okay. So can we just shift the focus a little bit from nutrition maybe to other issues around collateral damage? So there are some people who have never spoken up yet. Who wants to tell us his observations? There are some people left still.
Can I talk? I'm
Evangelos
from Greece. Okay, I'm a general practitioner. I'm ex-vice president of the Greek Association of GPs. I think the situation is that we have a lot of hidden problems at the moment. It's clear from cardiovascular medicine that patients with infarctions, with STEMIs, are less than 40% than the same period last year. So even patients with severe problems don't show up at the hospitals. And because they're afraid that if I go to the hospital, I can get infected by COVID. So there is a clear message that you should not go to health services except if it's very necessary to go there. And all these things are hidden. No, many problems.
Evangelos, how are you managing your patient at the moment? How are you doing it? And is it working well, or?
The problem in Greece is that we don't have an organized primary healthcare system. So even in the past, we had problems. Now, because especially in urban areas, we have private doctors covering people. What we do is not to almost have our doors closed at our practices. We skip to telephone consultations, and only if there are problems not related to respiratory problems, because most of our practices don't have the means to see a probable COVID patient. Only then we very few we accept to our practices, and there's a big gap between telephone consultations and hospitals.
Yeah. So what would you say? Who are the vulnerable groups from your point of view, from the practice point of view? Children, elderly, chronic, people with chronic diseases?
All of the groups will have problems. Okay. Because we postpone everything that is not necessary to be done now. So okay, we don't do checkups, we don't do regular wellness examinations. All of these are.
But how long can you postpone?
That is a big question, because we worked very well in imposing restrictions in restriction measures, and we are lucky that we don't have a major outbreak in Greece with a few deaths and admissions, but it's very strict, and we don't know, because we don't have immunity. I don't know how long it will take to remove the measures. So
yeah,
it's a problem.
Yeah,
now the government is trying to do some things for this, to have some video calls that we never had in Greece till now, video consultations, and trying to recruit some GPs in our primary healthcare system, the public one. We'll see.
Okay, so how it is in the UK? So we have a psychologist from UK, I think, in the group.
Not sure if she joined. Christiana Zeliansky.
No, it's not here. No, Christopher.
No, she's not here. I think we better move maybe to your own country. Sanja Kaiser from Austria. Can you add something from your experiences?
Yes, hi. Can everybody hear me?
Yes, go ahead.
Yeah, hi. I'm Sanja Kaiser. I'm a GP with a public health background, working in a GP practice in Vienna. Hi, Diederik. We did our master's degree together, our public health degree. I don't know if you remember. Yeah, I would like to talk about my observations. So the first thing is that personally, or in my practice, I could not define any particular problems in primary care. We see patients that need to see us. We conduct video or telephone consultations when required. Our patients have access to necessary medical services. And principally, I haven't met anyone who could not access the service that he or she needed.
So you have no problem with specialist services like radiology in Vienna? I'm very surprised.
Not really. I sent my patients. I just had a patient after a bypass surgery, and he needed to have his blood work checked, his X-ray done, his EKG done. We did everything without any problems within a day.
But what about physiotherapy?
Physical therapy is a bit of a problem, of course, and also nursing services are a bit of a problem. That's where I see
dental services.
Dental services as well, indeed.
Yeah.
But access to specialists or access to ambulances in the hospitals, I have not really encountered someone who could not get what they needed to get.
Okay. And do you have the feeling that those people with chronic diseases, you still are able to manage them well? Do you see them often enough?
Yes, I see them regularly as needed. I see those that need to be seen by a doctor. They do come into the practice. I have sufficient protective gear because I bought it in time. Right now, I would be in trouble, of course, if I didn't have it. Yeah, and maybe I would agree with Lorena, who spoke first about not sufficiently structured or precise information. So I do get a feeling that patients are actively discouraged to go to a hospital ambulance. And yeah, that's probably the cause of this collateral damage, or one of the causes.
Yeah. So
as for the, yeah.
No, go on.
As for the vulnerable groups, yeah, we do see, I mean, I work pro bono also for an ambulance that sees uninsured patients in Vienna. And they are, of course, a vulnerable group with or without COVID-19. Another group that makes me worry are patients who need or require medical attention at home, because many colleagues and also the nursing services do not have adequate protective gear.
Yeah.
And cannot conduct safely home visits.
Yeah. Just an observation what our GPs here in Graz have, in Austria as well. So they say that people with mental illnesses, so who need medication, they have problems somehow managing them, they say. And people with pain, with chronic pain, they say it's also an issue. And what they also see is rising numbers of anxiety and these kind of problems. So yeah,
that is very correct. We observe increased mental health issues, especially anxiety. However, we as GPs are quite capable of managing to an extent pain problematic problems or mental health issues and prescribe medication. I know also of psychiatrists that actually still do see their patients or have video conferences and prescribe medication through e-medication as we do.
Yeah, are you as well postponing things?
Sorry, again?
Are you postponing things like health checks or whatever you are able to postpone?
Yes, we do have to postpone health checks. They're not being done because we have an official advice of the medical chamber. We should not see patients that don't require immediate medical attention.
Yeah.
So that is all postponed for later. What's more worrisome is that some operations are postponed.
Yes,
and,
absolutely. Yeah.
Yeah.
So we were talking just before lunch. We were talking about people with cancer who are in a regular treatment kind of regime, and they are postponed as well. And for them, it's quite worrying. What does it mean when my treatment is changing?
I did not observe that. I must say I have several cancer patients whose chemotherapy or palliative therapy is ongoing. So I cannot confirm that.
As a last question, any observation in children in your practice?
No, we have quite a few children as patients, but we did not. And I know of pediatricians who work regular hours and see their patients just as we do. So no problems in that area.
Okay, thank you very much for this interesting observation.
I would just like to add a little something about your last point, strategies to tackle collateral damage. I feel that in Austria, there is not really a coherent public health strategy for such issues and problems. And yeah, that would be something I would wish for as a GP.
Yes, I would go even further. I would say we don't have the awareness at the moment among politicians because everyone is looking at the intensive care and hospital care, and nobody's looking actually at regular care. But this focus group is also about. And one thing I want also to add here is we have an open Google document where we collect case stories, and I can share the link with you. Very interesting. Austrian case stories from different settings, different professions, and I think well organized. I think we have 150 stories at the moment. Yeah, so
I'd love to see that.
Yeah, I send it to you. So
thank you,
Simon. Thanks.
May I repeat my message that if you are opposing ideas or other recommendations, please put them on the chat box, because I think that's important. If you disagree, also put it there. Tino, anything to add from Spain on cancer patients, for example? What's happening in primary care? Can you report a little from Spain, from Barcelona?
Hi, everyone. I cannot report from the front line because I'm not a health professional and I'm not anymore working in a primary healthcare center. So I'm not in a position to provide insights at this level. But I would like to open maybe another stream of discussion, that is the long-term collateral damage from a more organizational perspective. And this is something that we are realizing here is like a missed opportunity for primary care, because all the focus has been in emergencies and intensive care units, and hospitals are all the time like the main characters, the protagonist of all this story, and primary care is a bit neglected. And I think this in the long term will be negative for the future investments that are required. It look like everyone is thinking that all the cuts, because the fiscal consolidation during the crisis back in 2010 are responsible for the situation, and this will mean that new investments will be focusing in more hospital-centric model of care. So this is something that I would like to bring, but not at the level that you have the discussion. Maybe if it's interesting, or you can discard and continue with this level of discussion. Over to you.
Martin, your microphone.
Yeah, I finish. I over to you.
Yeah, thank you. Very interesting. But I'm also very interested how the future will be and what are the lessons learned for health systems as well. So yeah, And I also think that they have different phases. So at the moment we are at the beginning. So we are now the things can change, and even collateral damage can change. So I don't know. We will see. So I just want to invite anybody else who hasn't spoken yet.
Can I talk? Can you hear me?
Yes, Tessa.
Are you Tessa?
Yeah.
Yeah.
Hi.
Hi.
I'm Tessa Richards from the BMJ. I'm
Yeah,
the BMJ partnership editor.
Do you have a question or a remark, Tessa?
EP. I just have one comment. Is we're about to publish a piece on, if you like, collateral damage. It's a horrid term, and I really invite you all to respond to it with your personal experience and
Tessa, can you
this journal, and also I'd be interested to know where your this list where people are putting their stories on, because we're also holding a roundtable podcast discussion on this. With
Tessa, could you please Tessa, could you please put it in the chat box? But this is really information we can share through the chat box as a report.
I can't find the chat box. I can't see it on my screen.
Okay, well then send an email message to us, and we will spread it in the reports. That would be
I will
great.
do that. Thanks a lot.
Thanks a lot.
Bye.
Maybe we would go to Turkey once more. This afternoon we have been speaking about Turkey, but Mehmet or Emrah could report from primary care level in Istanbul. What are the collateral damage issues at stake?
Hello, everyone. I am not sure if my microphone works.
It works.
Okay, cool then.
Yeah.
Okay, my dog is also barking here. In Turkey, we have. I am in Istanbul. It's like a European city now because streets are empty after 7 o'clock. It's new for us. In the primary care level, the issue is not handled from the primary care view, as everywhere, most places. Everybody wants to go to hospitals, and the pandemic answer comes from hospitals. So it's becoming a burden for the hospitals, and the patients are like in Italy, don't going to hospitals because it's not easy to get tested or to have a bed. And for the next week, I think all the hospitals will be full. They are building up new hospitals and open 2 new ones in Istanbul. But there's no primary care point of view, which makes us to couldn't catch up the cases early because people are waiting for bigger issues like fever and breath issues, and then it makes them a week later to go to the hospital. If we can catch the patients earlier, we can isolate them easily, but it's not working well now. For the vulnerable groups, there's lots of people, millions of people home based, but every physician and every healthcare worker is a bit afraid of patients and don't want to get infected, to go to houses and get infected or transmit any disease to the patients. So the home-bounded people are having big issues for their care. If they have getting warfarin, they can't do tests because they are elder people, they have cardiac issues, and they can't go to the hospitals, and we don't do the test in the primary care, so it's a problem for them. And there's a specific group with respiratory health needs, like amyotrophic lateral sclerosis, who needs oxygen with the machines and ventilators, but it's very expensive now. All the machines and the stuffs needed for the respiratory ventilators, so they can't find them. It's another problem. We all postponed everything, whatever we can do. We don't, the dental health stop also because of the risk of transmission to the patients and to the healthcare workers. So lots of dental problems hurry to the primary care, but no dentist. And it's not easy to make an examination to the patient, especially breathing and ear or nose or mouth check. It's not easy because we don't have full protection. We just have our masks, and it's not protecting anybody if the patient breathes deeply. So it's a problem. But it's the second week of pandemic in Istanbul. We are trying to postpone, but it is getting harder for the patients and for us. It's not easy to say that I can't do an exam because I don't have protection.
Emma, may I ask you something?
Yeah.
Do you have any observations about refugees in Turkey?
It's another big issue because more than 1 million refugees in Istanbul, and they don't have health insurance. So it makes them, they also postpone their health issues. And another one is they are young people, so maybe they are just spreaders, we don't know. Municipality trying to do something and NGOs trying to do something for them. But Mehmet can say better, but if they don't have insurance, it is hard to get tested or to have the tomography, something like that. It's not very expensive, but if you don't have money, it will be a problem for them. That's an issue. That's a big issue. And one problem is that we have foreign doctors who are having education in Turkey. They work in hospitals, but they also don't have insurance. It's just a bit legal problem. It didn't happen before, but in this pandemic time, it became an issue, a little one, but disturbing one, like you fly. When as not proactive but reactively, people are trying to fix the problems. If you are a refugee and if it becomes a issue, government, municipality, and NGOs try to solve it. But whenever it comes, it seems as a problem. People are just trying to handle high burden of patients. For our population is more younger. We have lots of babies and we have lots of pregnant moms. So they are also afraid to come to the clinics. So we are making time slots for them and special rooms and special entrance for vaccination, healthcare checks of children, and maternal care. If you have a chronic issue but not a COVID one, you try to find and if you need hospital care, you try to find COVID-free hospitals. Last week we had COVID-free hospitals, but this week it's fever. Everybody is trying to find out a COVID-free hospital, but it is not easy to find one nowadays. So it's a problem.
Yeah,
that's all we done.
Yeah, and we are three weeks in the pandemic. So Diderik, do you know who hasn't spoken yet? So please invite those people.
Can I just add a few things to Emrah? Actually, here is Mehmet. Can you hear me?
Go ahead.
Yeah, go ahead.
Yeah, just a few words actually. So Emrah is really working in the primary care, and I'm working in the University Department of Family Medicine. So I'm now at the moment running a sort of special triage for COVID patients in the university hospital, just in front of the regular triage of the emergency department. So I'm facing in the front line in the hospital all these patients. For the refugees, in fact, if they come, they are covered under a special fund. But of course, like language barrier and all other barriers becomes a real problem in these emergency situations. So disadvantaged groups are always disadvantaged in these conditions as well, because everything is very, very in a hurry, going on very quickly. I remember a few years ago, I read papers about training of emergency when we are dealing with chronic patients in primary care practice. But actually now there is the training of the urgency for the whole health system. So the whole health system is actually focused on this COVID. In our university hospital, in the outpatient clinics, you see hundreds of patients every day, and nowadays you see none totally, because all are gone to the COVID patients, all doctors, and they all canceled regular appointments of these patients. So they were called to stay at home. Well, it's really new thing. It's a few weeks now. Okay, these chronic patients may be fine for a few weeks and a few weeks more, but if it's longer, I'm really worried. Then in the emergency, when we are dealing with this COVID positive patients and trying to put them in the ICU, then we will also have very severe patients with diabetic ketoacidosis or hypertensive crisis and other things. So I don't know how far we can manage it really from distance, consultations. So especially in Turkey, the telemedicine is not that much evolved, to be honest. So this was the first try, to make phone calls with the patients at the moment. I don't know the other countries how you can deal with the telemedicine only with the chronic for the chronic care of the patients. But in the long term, I think I'm really afraid. I'm really ask where all these patients gone, and if they really have problems, who will really take care of them? So and in the hospital, 3 days, Emrah said, my hospital is a university hospital and has lots of different high quality services here, but half of the hospital is now only for the COVID patients. So it is very difficult if you want to have a serious for example, surgery, elective one, but still urgent. So it will be postponed really. So for a while, So I don't know how will this affect really in a few months, a few weeks later on.
Yeah, thank you, Mehmet. The same. We make the same observations here in Austria. That hospitals are postponing things, but they know when things change, then they have a big workload. Yeah, and then they not really know how to deal with it. And also, so the numbers of if they compare March and April of 2019 with March and April 2020, they say they have difference about 40% of heart attacks and stroke and stents, and they can't explain it. Where are all these people gone? Yeah, and so very worrying figures. So and nobody's really looking into it because
yeah, and for sure they will come back. They don't disappear. So.
They don't disappear. You're right. Yeah. So yeah.
What I'm surprising of this session that we do not hear so much, almost nothing about the mental health issues. What was very much discussed in the lunch time session. So I was wondering if somebody wants to add something on this. Also, somebody who have spoken already, please add your ideas about this from your country.
In Turkey, everybody gone crazy, so there's no mental issue. It's the new normal.
Okay, well,
you say people to stay at homes, but it's a crowded country. Istanbul is a crowded city. Small houses, lots of people in it. People are not sleeping. Also, this is the case for the physicians, we made an questionnaire for the physicians. 40% of them are crying, and more than 60% of them have sleep disorder. So it's really new normal.
I think Martin is a good example of this, isn't it, Martin?
Yeah. So, so just to finish up, we finished up the lunch group, and I really liked it. We finished up with positive. What are positive effects of healthcare systems in COVID-19 mode? Do you observe any positive effects? For example, that some countries suddenly you're doing telemedicine and you see that it's working very well, or you see some positive effects as well. Like, okay. Any comments about that? So we end up positive as in the lunch session. Any
Can I
positive
give you a
things?
positive message?
Yeah, please go ahead.
I'm a patient with stage 4 adrenal carcinoma, and for years I've been trying to get my secondary care hospital, the famous Marsden Hospital, to communicate online and by phone with no success whatsoever. Suddenly, overnight, they are now allowing patients to email them, and I was able to get the result of my last MRI scan from them with a very courteous telephone call. That never happened before.
Yeah. Anything else?
An example where it's face-to-face communication. We published quite a bit on positive changes, how giving patient groups more and patients more responsibility per form and communicating with them online actually has made them and stepping away.
You're getting scattered.
Yeah,
well,
Tessa, the audio is not very good at the moment. So any positive remark from somebody?
Hi, can I say something?
Yeah, sure. Go on.
Hello, I am Tuba from Turkey. I am a GP also, and I am now working as a deputy chief in a university hospital and working as a coordinator of COVID patients, looking after COVID patients. The best things in Turkey is, I think, people most of the time patients were angry with us. They miss their respect and they don't act like old times. But now they are so friendly to all the doctors. They are sending us foods, gifts, and other things in every shift. And I think they started to love us a little bit, and they try to show their respects in those days.
Okay. Yeah, that sounds nice. Yeah. So
yeah.
Okay. Yeah. I think in Austria as well. Hopefully those things that people get aware who is really running the system at the moment. So it's often the low-paid people and people with a migrant background, and also I think they get another view of the importance of healthcare systems or primary care. Hopefully. So yeah.
But then Martin, let me bring my own content in this discussion. I've started working at the municipal health service as a nurse, going back to my roots of 20 years not nursing in practice, and now I'm doing track chasing of COVID-19 patients, and we experience already, and that's sorry for ending negative. We get already very many complaints of relatives that their relatives got COVID-19, and they complain with the municipal health service that they didn't do enough prevention and so on, you know, and also all the measures. So it's changing again. But anyhow, I'm happy that Tuba is still experiencing the positive side of it. Mehmet, did you have one more comment on the positive experiences? I saw your microphone opening.
I want to say
yes, rock on.
It made us more like a team. It's solidarity is getting higher, because if anyone get infected, all the clinic will be in problem. So we work all together, and we speak much with the patients by telephone or something like that. But and we are talking much more things about the life issues and like that. I think it's better before, after. It's better for now, because we are talking to life issues. We are talking about the concerns much more. 2 months ago we were just talking about the pain, something like that. But now it's a threat. It's a real threat, and everybody is talking about it. I think it's better for our teams and our patients.
Well,
it's something different.
Okay, so thank you, Emrah. So I also want to add a positive comment. Actually, you know, the organization changed totally in the hospital, in the teaching hospital now. So everybody is nearly equal. So everybody needs to take after the COVID patients. Okay, infectious diseases and some internists are more on the front as the commander maybe, or the consultants, but for the rest, everybody is the same. And then the organization or the directory really understands the value of actually discipline inside them, who looks cool to the patient, and they want us to be everywhere nearly. So I mean, if there is a shift of combined trainers, they always want one of them to be the family doctors. If there is some general triage somewhere, and they want to put us there. So there's a lot of demand is coming from to us actually in these days. Well, this is somehow a little bit difficult for us, but I mean, it's a kind of realizing the value of, these doctors can look actually on all aspects of the patients, and actually you can put them anywhere for the general care.
Okay, thank you very much. Yeah. So Diederik, let's close up. Let's close this session.
Yeah, I think so. So Martin, thanks a lot, and all of you to contribute. Well, I want to end with the crucial question. We want to have a round 2 next week, probably on Wednesday, same time slots. And then to talk a bit more on specific issues related to collateral damage. So that can be mental health, that can be children, that can be cancer, or whatever, COPD. So elderly. Yeah. What we want from you now is putting in the chat box which is your priority area which you want to be discussed next week on, if it's about collateral damage. So if you can give just a few keywords in the chat box, we will evaluate all the ticks, and we will make a choice for next week, the webinars which we are going to prepare. So that gives you a few minutes to do that before ending the whole session. Maybe I can ask Tom to show on the screen the different invitations. So it's the one which showed, this is the one I'm just talking about. No, the one before, Tom. Yeah, that's the one. Next Wednesday, second round, same time slot, so 12:30 in the afternoon and 7 o'clock in the evening. And then the next day, we will have what Tom already announced. We have a collection of video presentations of primary care experience dealing with COVID-19. coming from Slovenia, coming from Turkey, coming from Latvia, Italy, of course. So that's an interesting, and we want to share those experiences and see what are the best practices and how can we learn from each other. So those are the webinars for the moment. And then we still have our survey planned on organizational issues in primary care. So we all invite you to add on that. Next to what Martin already mentioned, collecting best practices and the collateral damage issues in a Google Docs. So that is all what I can say now. I think we are just in time. Anybody with an urgent issue, question? If not, I'm going to close. And thanks, Martin, again. And Sarah. Sarah was on the back. Sarah, can you say just one word? You will do mainly the reporting and have listened well to all what has been said. So thanks a lot, all of you. Bye-bye.
Bye. So I just stay here a bit for